What does speaking up and speaking out about mental illness, what does that mean to you? Does that mean that they're finally understanding what's going on with you, and maybe they'll ask you questions and get educated about it so they're more accepting? And in order to accept mental illnesses, you have to speak up so they can be curious. They, as in society, can become understanding and try to get rid of that stigma that you might have mental illnesses, but you're also a person and you also have feelings. That's very important that they understand you still have feelings and you can be hurt. And a lot of mental illnesses, you can actually be hurt more by stigma and by being made fun of, by being judged especially. So we as a whole, not just a person here and there, but people who do suffer from mental illness and mental illnesses, need to make more people aware. There's plenty of other situations and other things that are in the spotlight, so to speak, and mental illnesses just seems to be taking forever. It's not something that is really talked about a lot, or really made aware of, as far as I'm concerned. I see, I watch commercials and it's about other things, mainly abortion, and I hate to bring that up, but that's a big one. That is a hot topic, if you want to call it that. I am not going to express my views about that because I have personal views about that situation and about that topic, but that's not what I'm here to talk about. I'm here to talk about how to get people speaking up about mental illnesses, and that it's not some scary monster in the closet. Sometimes you feel like that. And sometimes you feel like that's where you should be. But the thing is that it needs to be put on the front burner more so than a lot of other things. For the simple fact is, a lot of suicides happen because of mental illness. And that's true. A lot of people suffer from depression and they don't get the help they need because of the stigma. They don't want to be labeled. They don't want to admit they have a problem. They're embarrassed, they're ashamed, and they don't seek help. So, you need to, if you have a friend or a relative who has, we'll just use depression because my list is long, but we'll just use depression, even bipolar. That's another one that those you can get help on. I have borderline personality disorder. That one's a little more complex. That's the one that I hate the most because there's not a pill. I know. I don't want to take more pills. I hate pills. And I only hate pills because you get sick of taking them day in and day out. I forgot to take my pills. If you don't take your pills, you start to get dizzy. You start to get nauseous. You just don't feel right if you don't take your pills. And it's very frustrating. If they had one magic pill to make me feel normal, I would take that one magic pill. But I gotta take 5 or 6 at a time. And it gets old really fast. And I've been doing this for more than 15 years. So yeah, you it gets old real fast. And then they like to switch them on you. Let's try this. Maybe this one's not working. So, let's try this one. Oh, that one doesn't work either, because it isn't necessarily that they don't work. I find it's the side effects that are so bothersome that you don't want to take it anymore. I refuse. If I have side effects that are so severe that I just flat refuse to take the pills, I go back to the doctor and I'm not taking them because they cause this side effect or these side effects, and I just refuse to take them. What are they going to do? Like my mother would say, shove them down my throat? I hate her. But anyway, that's, as a child, and you don't want to eat your broccoli. I love broccoli. But, you don't want to eat what she made, and she goes, you better eat it or I'm going to shove it down your throat. I always love that one. It's like, yeah, go ahead. It's going to come right back up as fast as it goes down. So, as always, I have my notebook because I like to take notes. It helps with my content. It helps pinpoint things that are important. So, the awareness was a big one. They need to have more mental health, mental illness commercials than beer commercials or shaving cream commercials or, beauty commercials. Really? You're that self-absorbed? And why do they shave legs that don't have hair on anyway? That's always really complex. That always is confusing to me, and I find it fucking hilarious. Okay, so anyway. So yeah, in order to get awareness, or in order, you have to have awareness, and then you have to have acceptance. And that's the difficult part. People don't want to accept things that are out of the norm. They want everybody to be the same. They want everybody to be normal, which, like I've said in the past, I'd love to see normal. Maybe those are the people that are behind the pharmaceuticals. I don't know. But I'm just saying, normal, I guess, to me is somebody who goes to work, has kids, cooks every night, and it reminds me of when I was married. He expected me to be the Stepford wife. Now, I've never seen that movie, but I know what it is. He wanted me to be a robot. And I'm not a robot. I am a human being. I have feelings. I have emotions. I have very strong emotions. And I wish I wasn't so emotional. Sometimes. But sometimes it lets people know that what they've done or said really hurt, really affected me. And, well, because I'm one who jokes around all the time, I say I'm a fuck off. So it's like, I had my hair up and I try to take it down so I look somewhat normal. And yes, my background is different because I got an office. Yeah, things are a little bit different. I like it up here more because I feel like I can talk louder and not bother anybody. So I like it up here. But anyway, I'm off topic, which is I found out is part of the borderline personality disorder, where I talk about multiple topics all at once. And then I go around and around and around. It drives me crazy. In a way, but in a way I'm used to it. It's like, it's the way I am. But I'll try to get to that in a little bit on that topic, because I've already discussed it a little bit and I'd like to discuss it more. But so the key to awareness is speaking out and speaking up. Go and you're talking to your friend and she's like I said, she has depression. So teach her that, I know this doctor that you could talk to, and they could help you. I didn't know I turned my screensaver back on. All of a sudden it goes blank and I freak out that I lost all that content. Anyway, I'm sorry. I have ADD, so I get distracted really easy, which, duh. My therapist doesn't think I have ADHD, I guess because my Xanax works too fucking good and mellows me out. I don't know, I'm just kidding. But, I mean, because I'm older. And we even discussed that, you know, I've probably grown out of it. But I still have ADD, and my distraction, I get distracted so easy. It's not even funny, but it is, because I don't give a shit. Is what I am, yeah. Is what I am. I'm a grammar Nazi too, and you wouldn't know it. But anyway, so yeah, people need, you know, why don't they have, like, I don't know, I think in school, like high school, I think that would be too soon, but maybe in a class of biology, they could have not a semester, but yeah, maybe a semester, or in not phys ed, but in health class. Health class would probably be a really good place to mention mental illness. You know, I wish that people who have mental illness would go to schools and not protest, I don't want to say that, that's like pushing it down their throat, but suggest, you know, did you ever think about having a semester or something about mental health? Because I didn't have time to look up statistics, but the statistics of what they are, what percentage of the population suffer from mental illness, and start out with that. You know, go with your notebook and have your statistics in hand and say this percentage of the population suffer from some sort of mental illness. Normally, I think it's depression, and I don't want to say normally, but I think depression is really high up there, if not number one. Like I said, I didn't do my homework, but anyway, so I think that would be a good place to start. So when, I don't want to say a child, but anybody in high school would hear Aunt Sue has depression, Uncle Henry has, you know, why did I sound like I'm somebody else? Uncle Henry has bipolar, or your cousin has ADD. They don't say, oh my God, that person is, you know, and they label them. They get a label smacked right on their forehead. Illness, mental illness. And that's the sad part, is the labels, the stigma. Something's wrong with you. Well, no shit. Tell me something I don't know. What, do you think I like this? Do you think I asked for this? Do you think I enjoy this? And I'm sorry that I get upset about it, because because of the way I've been treated in the past, and really unfairly. And of course I don't like it. Who would? Oh, maybe there are some people, but I'm not one of them. So yeah, I think it all starts with education, whether it's in schools, in colleges, in prison. You know, the saying goes, if you picked up a Bible before you went to prison, maybe you wouldn't be there. That's just my spiel. My joke. Is it funny? I don't give a shit. But you see that, and I'm not going to even go there, because that's just another topic that I could make fun of. So then we have education and sharing. Okay, so you share what you know with somebody you know. And they say, oh, you know, they get educated on it. Well, then hopefully it kind of shit rolls downhill. So maybe if you educate one of your friends, and they're sitting around at game night. I would say a party, but Nah, I'd be pissed because I'd be missing out on it. But, you know, they're sitting around together, hanging out, and somebody goes, oh, did you hear so-and-so is bipolar? You know, a mutual friend. And then you got 4 or 5 people saying, really? And they say, yeah, you know, I just found out, and this and that. Well, hopefully, you know, out of those 5 people, somebody will go and maybe do a little research on it, or maybe go and ask somebody, do you know what that is? Or, you know, like I said, maybe it'll spiral and catch on. There's an idea, right? Maybe the government could get their shoes and get their nose out of your shit that they don't belong in. First Amendment, Second Amendment, I think you got the picture. The amendments are there for a reason. But maybe, you know, if what about some of these? I know that psychiatrists and therapists are really busy, but what if they would say, go to libraries or hold meetings to share, you know, like me. I have bipolar, I have borderline, I have, you know, what if my therapist would have said, oh, well, we're holding a meeting on this night, this evening, 5 o'clock, 6 o'clock, whatever, you know where I'm going, and maybe invite their relatives or their friends, not the therapist, but their patients, their clients, whatever they call them. I don't even know. I don't even care. It doesn't matter. But I'm saying, what if they would start inviting and maybe hold seminars? And I'm sure there are, but not any I ever heard of. But you know what the fuck I hear about? Drug counseling, alcohol counseling. Oh, why? Because they got in trouble. Drunk driving, trafficking drugs, you know, shit like that. But I never really hear about mental illness. I'm so flustered. I'm so worked up. Because it shit really pisses me off. Why do they get special treatment? Because they drink? Because they got busted dealing drugs? We didn't. But we don't get special treatment, do we? I think so. So, let's see. I can't even read my own chicken scratch because I wrote it in a hurry. But, you know, like I just said, society accepts drunk driving. Oh, you got busted for drunk driving. Okay, you sit in jail for however many times you got drunk, you know, busted for drunk driving. You know, if you got busted more than once, I mean, I knew a lady, she got busted. She sat in jail until she was sober. 2 or 3 days maybe, and then, you know, she was cut loose. Depending upon, I think, your blood alcohol level, you have to have, you know, your ignition. You can't fucking start it without blowing in the breathalyzer. So, you know, then they have to go to AODA meetings because they got caught drunk driving. Then you have your drug dealers. Well, then they have all sorts of facilities that have therapy, counseling, rehab. They have all that. But I can't say I've ever heard any meetings or any groups. Maybe once or twice, but none that I really can recall. I'm talking about not in the way of frequency that these other groups, which I wouldn't go to a group because I hate group. I like one-on-one therapy. That's it, cut and dry. Don't stick me in any group because I'm not going. I don't like, I guess it's kind of contradicting, but I don't like people knowing my shit. Is it contradicting? No, it's personal preference. If I wanted you to know my shit, I'd put a big sign in my front yard spewing, you know, my personal issues. But that's what private therapy is for. You know, if people will want to get together and compare notes on how mental they are, that's their prerogative. I'm just saying it as a suggestion that it falls under education. People need education. And you know, if they don't want to go to a group, Google it. Watch YouTube videos. There's more than enough content out there that they could learn a thing or two. And I know that out of experience. It's just crazy how society accepts. And you know, I didn't do my homework to find out how many people die from drunk driving crashes, or drunk driving period, overdoses of opioids and meth and, you know, drugs like that. How many die from suicide? And, you know, I didn't do my research on that because to me, numbers don't matter. Lives matter. Not black lives, not white lives, not brown lives, not purple. That's not what I'm talking about. Because when it comes to Black Lives Matter, you know what? My dog's life matters. I don't get into this color bullshit. I don't fall for that crap. Because everybody's life should matter. It shouldn't matter what color, what race, what religion. You get the point. But, you know, it's all about education and getting rid of that stigma and those labels. That's what it's all about. And the government, or, you know, come up with some groups like that. Not this Black Lives Matter, and that's a big deal. Abortion, that's a big deal. You know what? It's all a big fucking deal. It's called humanity. And people got to get the stick out of their asses and realize you're not perfect, you're not perfect, none of us are perfect. But there's those people who think they're high and mighty, perfect. They're a bunch of assholes. That's what they are. And I'm getting wound up. And I like getting wound up because the simple fact is it draws a point, and it, you know, it makes the point of, if you want to stop people from ending their lives, you gotta figure out why they're doing it. They're not doing it because they're out of ice cream, or because they didn't get, you know, the extra cheese on their pizza. I just ate, so I don't know, I'm talking about food. But I'm just saying, you know, there's a reason why this stuff is happening. And it's not just, I mean, you have a 10-year-old, 11, 12, 13-year-old hanging themselves in their closet. It isn't because they lost at fucking Minecraft. You know what I'm saying? There's more to it. Maybe they do have to start at a lower level. They have sex ed starting at what? 4th or 5th grade? Well, is sex ed, I'm like, is sex ed gonna kill them? That's not where I was going. I just meant, you know, they've got the cutting. The kids cut themselves with razor blades. They take pills. They become addicts at 11 years old, 12 years old, 13. You know, in their early teens, even before their teens. Because they have issues. They don't have support that they need. Society needs a stronger support system. Less drugs and alcohol. Sure, I smoke weed. You want to see my stash? It's right here. But I'm not addicted to it. I don't do it every day. I do it once every 3 months just because I fucking want to. Because it's legal here. Because I'm an adult and I choose to, you know. We've got liquor up the yin yang. But we're not supposed to do it because of the medication we're on. So we don't. We don't want to take that risk that something could go wrong. But boy, I'd love to slam some of that Dr. McGillicuddy. And it's called free advertising. I don't give a shit. I had Malibu, I think, and all. You know, I look at it, and I'd like to have a drink, and I could if I wanted to. But I have had a drinking problem in the past, not alcoholism, but to where I was bored, and I didn't have a job, so I would spend days, nights drinking, because that's what I did. My entertainment, my, you know, should we rock? I watch a lot of YouTubers, and they rock, and they go back and forth. I just sit here and but no, in reality is education. You need to, society needs to get educated that being mentally ill is not contagious. COVID is, and look at the fucking, you know, education on that. They even give out vaccines that I refuse to take because it hasn't been tested long enough. I'm not going to take something that hasn't been tested long enough. That's insanity. Now, I know that there's a company down south somewhere, can't remember where, but it doesn't matter really, that they were, or they are, planting chips in people. So if they want to go buy something, or you know, they punch in at work, they just, you know, scan their chip. They want to buy something in the vending machine, they just, you know, scan their chip. Fuck no. Because if anything happens, bam, they know where to find you. I know they know where to find you anyway, but still, I'm not going to be chipped like my dog, which none of my animals are chipped, because they have rights too. It sounds totally absurd, I know, but we take responsibility for our animals not getting out, not getting lost. Sure, animals do get out, and they do get they do get lost because they're naughty. Sure, I understand that. But still, we had it happen. We'd bought a puppy. She didn't know her name yet because we just bought her. We were on the way home. And we stopped because it was a long ride. And now I have gone and picked up numerous puppies, so this isn't new. So we stopped at the gas station so we could all go to the bathroom, let her go potty. I've had black German Shepherds, black labs, blah blah, you know, I've had numerous puppies that I've gone, sat down on the ground, they go potty, I pick them up, potty and poop, whatever they gotta do, put them back in the vehicle, and we're good to go. No, this little one decides to fucking take off. 4 days we were looking for her, and this was in a little town. I mean, I don't even think it's a town of 500, and she's lost. Nobody could find her, and she didn't know her name. Lo and behold, we found her way, way, way far away from where we lost her. Somebody heard a little scuffling in their barn, and they went to check, and in a box they found a little puppy. And lo and behold, it was her. And she did try to escape them as well, because she was scared. She was a puppy. And, you know, they took her to the police station. I mean, the police knew about her missing. The whole damn town knew about her missing, because I did work a lot with social media. But, again, perfect example right there. Education, awareness. People knew. So it helped find her in 4 days. That was a long ass 4 days. No, we don't have her anymore because she just wasn't a match for us. So that's life. It happens. It happens all the time. We've had it happen numerous times where we've gotten a puppy and it just doesn't work out. We find it a new home that's suitable, more suitable. So now we have our 4 dogs that are more than suitable for us. And our 3 cats, and I'm getting off track, I apologize, but it is really a good example of awareness education. That stigma needs to go away. It's ridiculous, because I probably both have heard of presidents in the past, people, high society in the past, high society now, that have, God forbid, depression or bipolar or, oh, pity me, pity me. No, fucking get up on that pedestal that you have that opportunity and speak up. Don't just sit there on your laurels and hide it. This is a perfect opportunity for you to help others. Why can't they figure that out? You have a few here and there, but there are so many. The sad part of it is this: by the time you find out, it doesn't matter if it's somebody high society, somebody famous, a friend, a family member, whatever it is. Half the time you don't find out until it's too late. And I think you know where I'm going. I don't think I have to spell it out for you. I think you got it. So I think that that was a really good topic to, talk about. I would love it if you would subscribe to my channel, like and share, and do that stuff that they do on YouTube. I usually don't mention it because I like to do these videos for me and for anybody looking for topics that I discuss. I appreciate that. I would really appreciate it if you'd subscribe, for the simple reason I do these types of videos every day, because it is a topic that is very close to me, because it's so important. So please, by all means, subscribe and look forward to more craziness. It's one of those things that it is what it is. You just have to be yourself. Don't do things to please others just because they want you to. You are who you are. Love yourself. Don't be ashamed. And subscribe to my channel. Thank you. Have a good told you goofiness. Sometimes I try to speak too fast and it comes out gooberish. So you have a good evening, and I will see you later during the week. Tomorrow.